You cough, you sneeze, maybe you laugh a little too hard, or you lift something heavy, and, well, you leak.
Yeah, it happens so much.
It does. And society, and probably your doctor, honestly tells you to just do more Kegels, just squeeze harder.
Right, that's the standard line.
Exactly. But what if the massive stack of clinical studies and physical therapy guidelines you shared with us today proves that squeezing harder is actually the exact thing causing the problem?
It is a total paradigm shift.
Welcome to the deep dive. We are looking at all this literature today to answer a question that fundamentally challenges how most of us understand our own bodies. We are asking, can overtraining the pelvic floor without proper relaxation actually worsen mechanical stress leaking?
And it's a huge question.
It really is. I mean, you shared this literature with us because pelvic floor health is usually treated like this absolute black hole. It's whispered about behind closed doors. And usually the assumption is that it's, only a topic for postpartum women or the elderly.
Which is such a massive misconception.
Right. Looking at your sources, this affects athletes, young people, men, women, everyone. And it all centers around something clinically called stress urinary incontinence, or SUI.
Yeah, so SUI is simply the involuntary loss of urine during physical activities that suddenly increase pressure inside your abdomen.
Okay.
So we were talking about coughing, laughing, jumping, sneezing. It is fundamentally a failure to manage internal pressure.
And the standard advice you get, if you even muster the courage to bring this up to anyone, is almost always a variation of, well, your muscles are weak, go do your Kegels.
Right, just do Kegels at stoplights.
Exactly. But when you were reading through this research, you probably had the same massive aha moment we did. For a huge portion of people, that standard advice is totally wrong.
It's completely wrong.
Yeah.
It's actively being applied to the wrong physiological state.
So break that down for us. Why is it wrong?
Well, to understand why the advice fails, we have to look at the anatomy of how your body actually manages physical pressure, because the pelvic floor does not operate in isolation.
Right, it's not just floating there.
Exactly. It is the base of what the sources call a pressure canister. So imagine a literal cylinder inside your torso.
Okay, a cylinder.
The roof of this canister is your respiratory diaphragm, which sits right underneath your ribs. Then the walls are your deep abdominal muscles in the front and your deep spinal muscles in the back.
Got it.
And the basement of this canister is the pelvic floor, acting like a muscular hammock.
So when I take a deep breath in, my diaphragm pushes down. That pressure has to go somewhere, right? So it pushes down on my internal organs, and that pelvic floor hammock at the bottom has to physically stretch and lengthen to accommodate the downward force.
Yes. It is a highly dynamic system. When you exhale, the diaphragm rises, and the pelvic floor gently lifts back up with it. They coordinate automatically with every single breath and every step you take.
But something breaks down.
Right. The problem arises when that hammock at the bottom loses its elasticity. It becomes what the clinical literature calls hypertonic, meaning it is in a state of chronic, constant tension.
I was actually trying to visualize this while looking through your notes, and the best way I can make sense of a hypertonic pelvic floor is to think about a clenched fist.
Oh, that's a great way to put it.
Yeah, so if you walk around all day with your hand in a fist, just clenching it as hard as humanly possible for hours on end, and then suddenly you trip and need to grip a handrail to save yourself, your hand is going to be completely useless.
It has nothing left to give.
Right. It is way too exhausted to generate the sudden, powerful grip you need in that split second. That feels like exactly what is happening to a hypertonic pelvic floor during a sudden sneeze.
The mechanics align perfectly with that analogy.
Yeah.
And the sources explain this through something called the sarcomere length-tension relationship.
Okay, sarcomeres, what are those?
Sarcomeres are basically the microscopic contracting units of your muscle fibers. For any muscle to generate maximum force, those fibers need to be at an optimal resting length.
Which makes sense.
But if a muscle is chronically tight, like your clenched fist, the fibers are already overlapping too much. They have absolutely no physical room left to slide and contract any further.
Okay, let's unpack this because this completely flips the script.
Yeah.
We are conditioned to think that a tight muscle is a strong muscle.
Oh, absolutely.
But you're saying a muscle that cannot fully lengthen cannot generate full force.
Exactly. The pelvic floor in this state isn't weak because it's loose and lax. It's weak from exhaustion and fatigue. It is essentially guarding.
Guarding against what?
Against pressure. It's locked in a shortened state, so when that sneeze hits and a massive wave of downward abdominal pressure strikes the canister, the muscle has zero give.
Wow.
It cannot absorb the shock, it cannot dynamically contract to pinch the urethra shut,
Yep.
and the pressure just blows right past the sphincter, causing a leak.
But wait, I have to push back on this a little bit because Kegels have been the absolute gold standard for decades.
Right.
If doing more Kegels on a hypertonic pelvic floor is like adding fuel to a fire, are we saying the entire medical community has been prescribing the wrong treatment? Like, why do doctors default to this advice if the research clearly shows it can worsen mechanical stress leaking?
It really comes down to a historical bias in how we view incontinence, combined with, honestly, a lack of specialized musculoskeletal training in general medicine.
Because they just look at it as a bladder issue.
Yeah. For a long time, the medical default for any joint or muscle failure was just to assume weakness. If a knee hurts, strengthen the quads. If the bladder leaks, strengthen the pelvic floor. It's a very binary way of thinking.
And doctors are super busy.
Exactly. Doctors have maybe 15 minutes with a patient. Handing out a pamphlet on Kegels is quick, assessing the nuanced neuromuscular tone of a hidden muscle group that requires a specialized physical therapist.
Which means millions of people are out there doing heavy strength training on muscles that are literally crying out for rest.
And it makes it so much worse.
And looking at your sources, this overtraining is a massive issue for specific groups, right? Particularly high-impact athletes. We are talking about gymnasts, long-distance runners, and weightlifters doing heavy lifting with poor pressure management.
The data on athletes is incredibly striking. In some high-impact sports, the prevalence of urinary incontinence reaches up to 80%.
80%, that is insane.
It is. These athletes are subjecting their bodies to immense downward pressure constantly. In response, the pelvic floor muscles can actually thicken and hypertrophy to such an extreme extent that they become completely hypertonic.
You just lock up.
Yeah, they lose their dynamic elastic response. They turn from a flexible trampoline into a stiff board.
So if a listener has been diligently doing their Kegels for months and they're finding themselves leaking more than ever, how do they know which camp they are in? Because the primary mechanical symptom leaking when you jump or sneeze is the exact same whether you are in the hypotonic lax camp or the hypertonic clenched camp.
Proper assessment is vital, obviously, but the secondary symptoms are the real giveaway.
Okay, what do we look for?
Hypertonic, or weak, pelvic floors are characterized by pure laxity. So you might feel a heaviness or a falling out sensation, which relates to pelvic organ prolapse.
But hypertonic is different.
Very different. The hypertonic group presents with a whole cascade of tension-related symptoms. Because these muscles are chronically tight, they create referral pain and they physically restrict blood flow.
Okay, let's talk about the restriction of blood flow because the sources mention ischemia. When a muscle is clenched 24/7, it physically pinches off its own blood vessels.
Yes. And without a steady supply of fresh blood, the muscle tissue becomes starved for oxygen. This oxygen starvation triggers pain receptors. That is ischemia.
Oh, wow.
So you might experience a deep pelvic ache, painful sex, or even sharp pain when inserting a tampon.
The notes also detail some really confusing secondary symptoms like obstructive defecation,
Yeah.
where the muscles physically won't relax to let you go to the bathroom.
Think of the puborectalis muscle, which loops around the rectum like a kink in a garden hose. Its whole job is to maintain that kink so you don't soil yourself.
Right. Very important job.
Absolutely. But to have a bowel movement, that muscle must fully relax to unkink the hose. If your pelvic floor is hypertonic, the hose stays kinked.
You literally can't push past it.
Exactly. You can push from above all you want, but you are just pushing against a locked door. And that leads to severe constipation and straining, which further damages the tissue.
And then there's the urinary frequency or the burning sensation that perfectly mimics a UTI. You feel like you constantly need to pee or it burns when you do, but the doctor runs a culture and it comes back completely negative.
That is so common. Those hypertonic muscles are irritating the nerves that supply the bladder and urethra.
So the nerves are just misfiring.
The brain interprets that nerve irritation as an urgent need to urinate or as a burning pain. You might also feel like your bladder never fully empties. All of those are massive red flags that your pelvic floor is too tight, not too loose.
This has to be so incredibly validating for anyone who has been struggling with this because the Kegel exercise isn't inherently evil, right? It's just being prescribed for the exact wrong physiological state.
Exactly.
But here's where it gets really interesting. If local overtraining causes this, why do people who never do Kegels still get hypertonicity?
That's the million-dollar question.
Because the literature points to a mechanical chain reaction starting in the hips, specifically a muscle called the obturator internus.
Yeah, the obturator internus is a deep hip rotator muscle. It sits deep inside your pelvis, forming part of the lateral wall. Its primary job is to help your leg rotate outward.
Okay.
But what is critical here is the anatomy. The obturator internus has direct fascial connections to the pelvic floor muscles.
They essentially share the same web of connective tissue, so pulling on one side of the web distorts the whole structure.
Yes, any tightness or dysfunction in your hips, maybe from how you sit at a desk all day, an asymmetrical walking gait, or an old lower body injury, causes that obturator internus to shorten and tighten.
And because of that fascia,
Because of that fascial connection, it literally pulls on the pelvic floor. It creates asymmetry, yanking one side tighter than the other, which completely distorts the pressure canister and makes stress incontinence worse.
it really is an interconnected web. Like, your chronic hip pain could literally be the mechanical cause of your bladder leaks.
It's all connected.
But the sources show it goes way beyond just joint mechanics. Mental stress plays a massive role. We always hear that people carry their stress in their shoulders, but the research suggests we carry it in our pelvis too.
We absolutely do. The clinical research shows that chronic stress and the constant release of cortisol trigger an automatic, unconscious guarding reflex.
Like a defense mechanism.
Exactly. When we feel threatened or stressed, the human body curls inward to protect its vital organs. The shoulders hunch up, the jaw clenches, and the pelvic floor violently tightens.
You included a study in your notes that was just fascinating. It showed that just looking at frightening or stressful images causes an immediate involuntary tightening of the pelvic floor muscles.
Yeah, it's wild.
You don't even have to be in physical danger. Just looking at a stressful picture on a screen makes your pelvic floor clench.
It is a primal, hardwired nervous system response. Now, apply that to modern life.
Right.
If you're constantly stressed at work, constantly in a state of low-grade financial or social anxiety, your pelvic floor might be clenched 24 hours a day, 7 days a week.
And beyond the psychological stress, I'm guessing this relates to physical habits we don't even realize we are doing. The sources mention the way we hold our posture when we walk or stand.
Oh, a major culprit is constantly sucking in your stomach.
Just the aesthetic habit of trying to look thin in clothes.
Yeah. If you are constantly gripping your deep abdominal muscles to hold your stomach in, you are freezing the front wall of your pressure canister.
Well, the diaphragm can't move.
Your diaphragm can't descend properly when you breathe because the belly won't expand. So the downward pressure of your breath is forced violently down onto the pelvic floor all day long, causing microtrauma and tension.
Or walking around with a tucked tailbone. If you walk around like a frightened dog with its tail tucked between its legs, you are chronically shortening those exact pelvic floor muscles, locking them into that clenched fist state.
Add chronic lower back pain to the list as well. When the spine hurts, the body craves stability to prevent further injury.
And it finds it where?
To get that stability, the brain recruits the pelvic floor to tighten up and act like an artificial corset. The pelvic floor sacrifices its own elasticity and its ability to manage continence, all to try and save your injured lower back.
So we have this perfect storm. We have physical trauma, intense athletic loading without relaxation, postural habits like sucking in our stomachs, asymmetrical hip tightness, and just the daily grind of psychological stress, all conspiring to lock our pelvic floors into a hypertonic vice grip.
Yep.
And then we sneeze, we leak, and society tells us to go do Kegels, which just clamps the vice even tighter. It is a brutal cycle.
A cycle that requires a complete pivot and clinical approach to break. Because the primary treatment for a hypertonic pelvic floor is not strengthening. It is a concept called downtraining.
Downtraining. Okay, let's talk about that. You have to teach a muscle that has been clenched for maybe 5 years to relax and lengthen before you can ever safely strengthen it.
Because if you try to build strength on top of dysfunction, you just get stronger dysfunction.
Right. So looking at the evidence-based methods and the sources, how does a listener actually achieve this downtraining?
It requires a multifaceted approach, usually guided by a specialized pelvic floor physical therapist. A massive component of this is manual therapy.
Manual therapy on the pelvic floor.
A therapist will physically release trigger points in the hips, the abdominal wall, and often internally within the pelvic floor itself.
Let's demystify that a bit, because internal manual therapy sounds incredibly intense to anyone who hasn't experienced it. How does pressing on a trigger point inside the pelvis actually fix the leaking?
Well, when the therapist finds those tight, knotted bands of muscle internally, they apply sustained pressure. This physical pressure forces the muscle fibers to finally yield and release.
And that helps the blood flow.
Exactly. When the muscle releases, the pinched-off blood vessels open back up. Fresh, oxygenated blood floods the tissue, flushing out the metabolic waste that was causing the pain and reversing that ischemia we talked about earlier. Restoring the blood flow is step one to restoring the elasticity.
Okay, once you have that mechanical release, the sources talk a lot about biofeedback to rebuild the brain-body connection. Because if you've been tight for years, your brain literally forgets how to communicate with those muscles. What does this biofeedback look like in a clinical setting?
It can involve surface sensors placed on the skin, but the most effective method mentioned in your sources is real-time ultrasound. A probe is placed on the lower abdomen, and you can actually look at a screen and see your bladder and your pelvic floor muscles in real time.
You can visually watch your own internal anatomy react.
That's amazing. It is. For people who have completely lost the sensory awareness of this area, visually seeing the muscle on a screen is a profound game changer.
Because they don't even know they're clenching.
The therapist tells them to relax. The patient thinks they are relaxing, but the screen shows the muscle is still clamped shut. It forces the brain to reconcile the disconnect. You keep adjusting your internal effort until you finally see the muscle drop on the screen. That visual feedback rebuilds the neurological map.
But obviously, not everyone has an ultrasound machine in their living room.
True.
The most accessible tool, the one the sources come back to over and over again for down training at home, is breathing, which sounds almost too simple. How does changing the way you breathe fix a mechanical bladder leak?
It goes right back to the pressure canister mechanics we started with. We have to retrain the coordination between the diaphragm and the pelvic floor. Remember the healthy baseline on an inhale, the belly expands, the diaphragm drops, and the pelvic floor must relax and lengthen. On an exhale, the diaphragm rises and the pelvic floor gently lifts.
But people with hypertonicity often have what the sources call paradoxical breathing.
Yes, they inhale, their chest goes up, and their stomach sucks in. This pulls the pelvic floor up when it should be dropping. They're fighting their own anatomy with every breath. So the clinical sources provide a very specific exercise to correct this and facilitate down training.
Walk us through the mechanics of that specific exercise.
You lie flat on your back with your knees bent to take the tension off your lower back and hips. You place your hands on your lower ribs and belly. You focus on a deep 360-degree diaphragmatic breath, expanding the belly and the ribs on the inhale, and mentally visualizing the pelvic floor opening and dropping towards your feet.
Okay.
Then on the exhale, instead of forcefully squeezing like a kegel, you pretend you are fogging up a mirror with your breath.
Making a long, gentle ha sound.
The ha sound is the key. When you exhale with an open glottis like that, you naturally engage the transversus abdominis, the deep core corset muscle.
Oh, interesting.
Because of how the nervous system is wired, when the transversus abdominis engages gently on that exhale, the pelvic floor naturally and gently lifts in perfect coordination. You do this repetitively to groove a new motor pattern into your nervous system, teaching the muscles to fire cooperatively without forceful, panicked squeezing.
So what does this all mean? It means that fixing mechanical leaking requires unlearning years, maybe decades, of squeeze tighter advice. There is a visualization in the sources that I think beautifully encapsulates this entire journey. It says to imagine a marble resting at the opening of your pelvic floor.
The marble visualization is excellent for assessing your baseline control and your ability to downtrain.
You imagine gently wrapping your muscles around the marble and lifting it slightly up into your pelvis. But the most important part, the part people with hypertonicity fail at, is putting the marble back down. You have to allow the muscles to fully, completely melt back down into the towel or the chair you're sitting on. If you cannot feel the melt, you are stuck in tension.
That inability to melt is the exact reason the Kegels weren't working. If you are already holding the marble halfway up all day long out of stress or bad posture, you have no range of motion left to lift it when the sneeze actually hits.
This deep dive has been such a massive reframing of how we view our bodies. When you were reading through this research, this was probably the biggest realization that strength fundamentally requires flexibility.
Exactly.
A tight pelvic floor is not a strong one. Overtraining those muscles without proper down training and relaxation can and will cause the very mechanical stress leaks you are desperately trying to prevent.
And if we connect this to the bigger picture, pelvic floor health is whole body health.
Huh?
It is not an isolated system you can just hammer with isolation exercises.
It's all connection.
Your continence is intimately connected to the mobility of your hips, the mechanics of your breath, your daily postural habits, and significantly, your psychological stress levels.
Yeah.
You cannot compartmentalize it. You have to treat the whole canister.
Which leads me to a final, slightly provocative thought for you to mull over as we end today. We talked about how the sources explicitly mention that mental stress and fear physically tighten the pelvic floor.
Yeah.
Just looking at a scary picture makes it clench. Now think about the daily reality of living with stress incontinence, the constant anticipation of a leak, the fear of sneezing in public, the anxiety of jumping at the gym.
It's exhausting.
It is. If mental stress physically locks up the pelvic floor, making it stiff and unable to absorb pressure, could the very anxiety of potential leaking be creating a self-fulfilling loop? Is your fear of leaking causing the exact chronic muscle tension that ensures your internal hammock will fail the next time you cough?
That is a very powerful question.
It is something to really think about the next time you try to, stress about stress incontinence. Maybe, just maybe, the first step to healing isn't squeezing harder. Maybe it's finally allowing yourself to exhale, drop the tension, and relearn how to feel the mechanics of your own body again.